Hi everyone, I'm Sarah Monti, and this is Mental Health Issues in Adolescence. Adolescence can be a period in life when the risk of mental health issues increases. This is a period of many changes, as it is the quote in between stage from childhood to adulthood. Suicide is the second leading cause of death in ages 15 to 29. Adolescent girls are at higher risk than adolescent boys. Non-national students, students from dysfunctional family structures, and students receiving educational support were also at a higher risk. Lastly, students at a lower socioeconomic status usually resulted in lower education, which put them at risk of mental health issues as well. These are some of the statistics from the CDC of adolescents suffering from mental health issues and feelings of suicide. Before the Middle Ages, people believed mental illness was caused by evil spirits. They would then treat it by trying to get rid of the evil spirits. However, in the late 1700s, Dr. Benjamin Rush at the Pennsylvania Hospital in Philadelphia brought the study of mental illness to a scientific level. His treatments included occupational therapy, amusements, and exercise. Soon after that came the reform on the welfare of children. Part of this reform included the Refuge for Juvenile Delinquents in New York City, which was actually the first juvenile reformatory. It also included the creation of juvenile courts, the passage of compulsory school attendance laws, and the crusades against child labor. After the 1930s, it became apparent that advocacy needed to go to a national level. The federal government increased their financial commitment to those in need. They made domestic policies that influenced advocacy. These policies changed as the presidents changed. Part of knowing how to help adolescents is knowing what policies and programs are available. As children grow into adolescent age, they have, quote, changes in hormonal shifts, brain development, and evolving social relationships. As you can see, the risk for issues related to mental health increases with age as children become adolescents, the highest being anxiety and the next being depression. Other impacts include early life stress exposure, such as financial issues in the family, domestic violence, parental conflicts, inadequate communication in the family, negative maternal responses to emotions, or having fathers with a lower education level. Also, not living with both parents and unfavorable living conditions. Other factors include socioeconomic status, migration status, school-related factors such as needing academic support, missing school, experiencing bullying or engaging in bullying behaviors. Cognitive fusion can also play a part, which is the, quote, tendency to become entangled in one's thoughts, interpreting them as literal truth. Also, using tobacco, alcohol, or cannabis can put them at risk. Support from friends, family, and the school make a huge difference. This is data from the CDC showing how important it is to have supportive people in their lives. As you can see, support from friends shows an improved regulation of distress. Social influences are extremely important to adolescents, but it is also important to have a supportive family who have positive parenting practices, quality communication, they use active listening, control of expressing negative feelings, mutual expressions of affection, and are safe, stable, and supportive. Adolescents should also have access to education and community resources and positive relationships with their teachers. Also, special attention should be paid to girls, immigrant youth, and students with special needs. Findings from the positive mental health studies can be, quote, protective factors and targets for early intervention. Interventions to improve emotion regulation and targeting cognitive fusion can also be helpful. Using positive reformulation strategies, which is changing a negative thought to a positive one, has been successful. Development of emotional self-regulation skills and strengthening peer support networks at a school-based program could also be helpful. Parents and teachers should be involved with the students and making sure the strategies are sensitive to gender, sociocultural backgrounds, family structure, and academic risk. Many culturally diverse groups suffer from inequities resulting in a lower socioeconomic status, lower education, less political influence, and limited access to health and human services. They face many challenges in finding adequate mental health care, including lack of minority practitioners, lack of linguistically and culturally appropriate services, a system of care that do not respond to special cultural needs of the diverse population, and other issues. As a result, they experience their treatment being postponed or not taken care of in a timely manner. To avoid many of these issues, a human service representative must be aware of clients' cultural background. Thank you so much, and I hope you enjoyed learning about the issues of mental health in adolescence.